everyone. Welcome to today's webinar on EVV Phase 2, Key Things to Know, with time for question and answers at the end. Just a reminder for everyone on the line, we are recording today's webinar so that it can be recorded and posted to ODM's EVV Initiatives webpage. We're going to start with a quick sound test. We are testing sound at this time, so testing 1, 2, 3. For anybody who's logged into the webinar and can see the screen but cannot currently hear me, hopefully they're able to read the slide at this time and see that you can go to the website to get some assistance, medicaid.ohio.gov/EVV website to see this webinar at a later time. For easier viewing on today's webinar, and actually I'm going to back up real quick. If you have a question on today's webinar, please feel free to go ahead and type it into the chat icon or chat box that's located in the webinar bar, and that'll be on the bottom right-hand side of the screen. Your instructor in the EVV team will answer as many questions as possible during the time allotted at the end of the webinar. For easier viewing, you can make the presentation a full screen size. And to do this, you may click the Enter Full Screen button in the webinar window to make the presentation larger on your screen. To get back to the window where the chat box displays, hover over the top middle of your screen to see the webinar bar, and then click View Options, and then click Exit Full Screen. The items that we're going to cover on today's webinar include a review of Phase 2 program changes, a review of key Phase 2 changes to the EVV system, which would include changes in client data entry, visit maintenance, and logging visits. And then finally, we will answer questions regarding Phase 2. We will start by reviewing the Phase 2 program changes in general. And before we do that, as a quick reminder, Phase 1 of the EVV program included the services that you currently see listed on the screen. And Phase 1 of EVV was implemented January 8th of 2018. It included Medicaid fee-for-service services, such as state plan home health aid, state plan home health nursing, state plan RN assessment, the Ohio home care waiver nursing, personal care aid, home care attendant, and RN assessment services, and private duty nursing. One of the biggest changes about Phase 2 are the services that have been added and the payers that have also been added to this phase. This would include services that are provided under managed care organizations who bill Medicaid, such as Aetna, United Healthcare, Molina, Buckeye, Paramount, and CareSource. And the EVV implementation of managed care applies to services such as state plan home health aid, state plan home health nursing, state plan RN assessment, the HCBS 1915C waiver nursing, personal care aid, home care attendant services, and private duty nursing. But please note, self-directed services are not included in Phase 2. Additional payers of the Ohio Department of Aging and the Ohio Department of Developmental Disabilities have also been brought on board in Phase 2. For ODA, the services include passport services that cover home care attendant nursing and personal care, passport personal care, and passport waiver nursing LPN, passport waiver nursing RN. But again, please note that self-directed services are not included in Phase 2 for ODA either. For DODD, the services that have been added include individual options, or IO waiver nursing, IO Level 1 Homemaker Personal Care, or HPC codes. But there are a few exceptions to these codes. For instance, this will not apply to participant-directed services, and EVV will also not apply to the on-site or on-call component of HPC, or services billed using the daily billing unit. So if you currently provide a DoDD service that may be listed here, but you are using the daily billing unit, that service is not subjected to be entered into EVV. Now, since there have been so many services added in phase 2, but of course there are a lot more services that are provided to individuals, I do want to point out that there is a general list of excluded services for phase 2 that you can find on the ODM webpage. So if you still have outstanding questions about whether a service is or is not subject to EVV, this is a great resource to go to, and it's at medicaid.ohio.gov, the address that you see on your screen. There's also a screenshot that's called out here so that you can see where exactly that link leads you. If you were to go to the ODM webpage and click on the Providers tab, there's a Resources section towards the bottom of that tab, and there's a link for excluded EVV services that you can click on from there. Next, we're going to cover changes to client data entry for phase 2. And this includes a newborn indicator in the client profile, use of alternate Medicaid IDs, the ability to request devices from the client profile in the EVV portal, and the ability to add payers to client profiles. Starting with a newborn indicator checkbox that has been added, one of the client profile changes, since there are services included in phase 2 that would apply to newborns who may not have yet or likely have not yet been issued a Medicaid ID, there needs to be a way to indicate that an individual receiving services is in fact a newborn, and that is why you don't have a Medicaid ID to put in the required Medicaid ID field. And the answer to that scenario is this newborn checkbox. If you were to check this box in a client's profile, it would gray out the Medicaid ID field, and it would indicate, hey, I don't have a Medicaid ID because this is a newborn, and the development or the creation of that Medicaid ID is currently in progress. Now, in a few slides, we're going to take a look at the Add Payer screen. One of the fields that has been made available in that screen is a client payer ID. So while the newborn may not yet have a Medicaid ID, they still likely have an ID of some type that has been issued by the payer. So you can indicate that ID for the newborn in that client payer ID field, and I'll point that out again when we get there. Please note, however, that the mother's Medicaid ID should not be used if the newborn does not yet have a Medicaid ID. All right, so just because the Medicaid ID field is required, please don't feel that you have to put something in there. If the newborn themselves don't have one, just check this box and that requirement will temporarily go away. When the newborn does receive their Medicaid ID, you would just come back into the client profile, uncheck the newborn box, and the Medicaid ID field would become available for you at that time. Another addition to the client profile screen is the alternate Medicaid ID field. There are some scenarios where an individual could receive a new Medicaid ID, and you would want to be able to retain the old ID as well as the new ID so that billing could be applied appropriately for either of those. Examples of when a new Medicaid ID could be issued include a lapse in coverage or an adoption of a young individual. In general, any instance which causes a new Medicaid ID to be created for the individual, the new Medicaid ID should be entered into the alternate Medicaid ID field. This may mean that you should go back to existing client profiles that you have in place and add this in if you had already been using EVV prior to phase 2. Note that also called out on this screen is the Request Mobile Device button. We're going to talk further about that now, so I'll go ahead and move on to the next slide. But this button allows the ability to request an EVV device for the ODM EVV program directly from the client profile instead of having to go to eTrack and request the device from there. You still have the ability to request a device from eTrack, so if that is a process that you are comfortable with and familiar with, you may still go ahead and use that process. This is just an added feature to help streamline that workflow and save some time for providers. The way that you would use this functionality, let's say you are an existing EVV provider before Phase 2 came into place, and you have added a client recently that you have not yet ordered a device for or requested a device for. You would first search for that client and bring up their screen before using this button. If you have just entered a client into the system, so I just clicked Save and set up this client in EVV, it is after you save the initially created profile for the client that you would see this Request Mobile Device button. So I just want to point that out, is if you just added a client, you won't see this button until you first save all of their information, and then on their profile screen will you see this button. Now, the way that this works is once you click Request Mobile Device, you'll get a pop-up box on the screen, and any address that you have entered into the client profile for that client will be displayed for you. And this is one of the key reasons why you must finish setting up your client profile before you see this button. Because if you don't have an address to select from, you would have to close this box and go back and add that address in at that time. If you've added multiple addresses for your client, you'll see multiple addresses here. If you've only added one address, you would see one, but you would select the most appropriate address for the device to be delivered to. And there's also a box for special shipping instructions. You don't have to type anything into special shipping instructions. This is just available in case it's needed. For instance, if there are two outer doors to the individual's home and one is where the delivery should be left or placed, this is a good place to indicate that information. But please note, as the note in the box says, no PHI should be entered into the shipping instruction field at any time, because this actually becomes the text that gets put on the shipping label of the device box itself. So once you've selected the address and entered any shipping instructions, if applicable, you would click Complete Device Request. You'll get a confirmation screen pop up just to make sure that requesting the mobile device for this client is what you intend to do, and if so, you would click OK. If all goes as expected, and we have no reason to believe otherwise, you would see the green success box appear, and it says mobile device successfully requested. And it's at that point that you could go on to the next action that you intend to do, whether that's requesting another device for a client or working somewhere else in the EVV system. Now, there is a slight caveat to requesting that device, and this comes into play for the new payers that are available in Phase 2. If you have a PIMS ID, and this would come into play for ODA providers who are providing passport services. So if you only have a PIMS ID for a client and you do not have a Medicaid ID for that client, there is a special way to order the device. Similarly, if you have a newborn that you would like to request the device for, there is a special way to request their device as well. At this time, if you are requesting a device for either of these types of clients, it would not be done through that Request Mobile Device button that we just showed. We are currently working on the ability to do this through the EVV portal, but at this time, to request these devices, you would want to go directly to the eTrack portal. Now, the special setup of requesting a device for either of these clients is listed on the screen, but we'll go ahead and walk through that now. And please note that if you do not have a Medicaid ID for either of these types of clients, so you could have a newborn who has received a Medicaid ID, you could have a client receiving passport services who has both a PIMS ID and a Medicaid ID. In either of those cases, you would want to go ahead and use the Medicaid ID to request a device for these individuals. It is only if you do not have a Medicaid ID that you would need to use these special circumstances. So if you have a client who only has a PIMS ID, you can log into the eTrack portal and go into the area using the training that is in the agency and non-agency training guides for phase 2. So it'll walk you through how to request a device. But when you are walking through that process, the key thing to remember is that instead of entering the Medicaid ID, you would put in the PIMS ID, but you would use the format of first putting a capital P and then entering the PIMS ID, and then filling out the rest of that field with zeros to equal a typical Medicaid ID length, which would be 12 digits. So as an example, let's say the PIMS ID for my client was 1234567. The ID that I would enter in eTrack in the Medicaid ID field would be capital P to indicate a PIMS ID, 1234567, 0000, and that makes the entire ID 12 digits. If you have a newborn ID for a client only, there's a similar setup to this. You would log into eTrack, go through the typical steps to get to the device request screen for the individual, and in the Medicaid ID field, where you would typically put a Medicaid ID, you would put in the newborn ID for the client or the other payer ID for the client using the format of first putting in the EVV STX account number that has been assigned to you. So if you're a non-agency provider, for instance, this would be the 10086 number. Then you would put a capital N to indicate it's a newborn ID. Then your EVV generated client ID, and then zeros. So every time you enter a client into the client profile of SANDATA's EVV system, SANDATA assigns a unique client ID to that individual. That's the ID that you would be using here. An example of this you see here on the screen is 6789, let's say that's your EVV account number, capital N, 0192, which would be the EVV generated client ID, and then 3 zeros, because that would equal the total Medicaid ID length of 12 digits. Now these slides will be posted to ODM's website under the webinars section of the EVV initiatives page. But if you also have additional questions regarding this process, please don't hesitate to reach out to the EVV provider hotline, and they'd be more than happy to walk you through these special circumstances as well. Another change that's been made to the client profile that's important to call out and to remember is that you have the ability to add a client payer to the client's profile, but you also must add the client's applicable payers to their profile to avoid receiving the unauthorized service exception that could show up on a visit. And we're going to review that exception when we get to the visit maintenance portion of key things to know. But a good way to avoid seeing that exception is to make sure that you have set up all the applicable payers under the client profile using the process that I'm about to show you. Now on this screen, the red arrow at the top of the screen is pointing to the create client step. That's because when you first go to a client screen to get a new client entered into the system, you would see this add new under the client payers section on that new client screen. You would also see this client payer section and the add new option on an existing client's profile. So if you are a provider who has already been using EVV and you log into EVV, search for your client, bring up their profile, you are now going to see this additional client payer section. And you would want to go ahead and go in and add the payers for each client that you already have entered into EVV. The way that you would add a payer is you would click that add new icon, or button rather, and then you would see this pop-up screen. And you'll notice in the upper left-hand corner of the pop-up it says add edit payer. Your client's information is displayed across the top of the box, so you'll see the client's name. If you have already entered this client's profile and saved it, you would see their SAN data generated client ID number, their Medicaid ID number, and the supervisor field is not used in the ODM EVV program, so you would always see unknown there. You'll notice that some of the fields on this screen have asterisks next to them, and that includes the payer, program, service, and start date fields. You'll also notice that the program and the service fields are currently grayed out, and that is because you must first select a payer in order for the appropriate programs for that payer to be displayed. And then you must select the program in order for the appropriate services for that program to be displayed. So the example that we now see is the payer ODM has been selected. The program of SP or state plan has been made available in the dropdown, so that's what's been selected here. And once state plan has been selected under program, the service of state plan home health aid was available to be selected from in the service dropdown. So those three have been selected here. Under the start date field, April 2nd, 2019 has been selected. Now, the ability to add payers to a client profile was not in place before May 6th of 2019, so just several weeks ago. You can make the start date for this payer before 5/6. However, there's really no need to, because the start date does not indicate when that client originally became eligible to receive services under that payer. This start date field is really only used for EVV purposes. This start date field is what's telling EVV, hey, from this date moving forward, please recognize this payer as an eligible payer for this client. So essentially, the date from which you are able to start logging visits for phase 2 services is the date that you would typically need to add a start date for your payers. Now, this is going to change over time. So let's say you have a new client that you need to add to your system a month from now. You're not going to set 5/6 as your start date for the payer because it's not necessary. That's not when the client was available or even receiving services from you. So just keep in mind that if you're setting up a client as a new client for the first time, if you've already been providing services for a couple days, set the start date back a few days, enough to cover the service that might have been selected by your staff. But otherwise, you can go ahead and use the start date as the day that you set up their client payer, or May 6th if you've already been logging phase 2 services for several weeks now. You do also see that client payer ID field here. So a little bit ago, when I mentioned that a newborn who does not yet have a Medicaid ID has likely been assigned a payer ID by the payer, this is the screen where you would enter that ID. So that can be that visit, that information can be attributed to that newborn. You'll also notice on the right-hand side of this box, there's an end date for this payer. So if a client is no longer eligible to receive services for a certain payer, you would want to come back to their profile to edit the payer information and to add an end date to that service. If you don't add an end date to the service, it will still show up as an eligible service to be selected in the mobile visit verification device when staff log in. So when a direct care worker goes to log into mobile visit verification, they'll see this service is applicable and they could still select it. So to keep that from happening, you would add an end date and it would no longer become available. Now, I mentioned the ability to edit a moment ago, and you can see that on this screen. So the payer that we were just adding has already been added, which means it's showing up under the client payer section. I do still have the ability to add a new payer by the add new option on the left-hand side of the screen. I also have the ability to see a history of payers that have been ended already, and that's by the history button that shows up on the right-hand side of the screen. Otherwise, the payer that I just set up is listed here. So our start date of April 2nd, no end date just yet, no client payer ID needed, my payer program and service, and then to the right of that is a column that says action. With the pencil icon, you could click on the pencil and edit this payer, program, or service if you needed to. So maybe you needed to edit the start date, you selected the wrong service by accident, or you needed to add an end date. All of those would be scenarios where you would use the pencil and edit that payer. To the right of the pencil is a new icon. It looks like two pieces of overlapping paper, and if you were to hover over it, it would say copy payer. This is a quick add function that has been added. So if you clicked on these two pieces of paper, you would see the same add client payer box, let's go back a little moment, show up that you saw a moment ago. There we go. And let's say you needed to add another service that fell under an ODM, that fell under the state plan. This is a quick way to just click the drop down for service, select the new service that you need to add. You could even keep the same start date if it applies, and then click add. So there's very few fields that you would need to edit and change, and you would quickly be able to add a second payer for this client. All right, the next item we're going to review are changes in visit maintenance. And this would include the new unauthorized service exception that I mentioned a little bit ago, configuration of exceptions by payer that is new for phase 2, and a new option, or new options rather, that are available to you in the visit display grid in visit maintenance. Starting with the new unauthorized service exception, this exception would appear on a visit where a service has been selected that has not been set up under that add payer section that we just reviewed for the client. So as an example, let's say I have a direct care worker, let's say I'm an agency, and I have a direct care worker out in the field, and they may not be familiar with all of the phase 2 services that could be selected. So they select a service, but it's not one that has been added for this client, or it's not one that applies to this client. If the service, program, and payer associated with that service have not been set up under the client profile, you're going to see this unauthorized service exception, basically showing that this has not yet been added for this client, so it's not recognized as needing to or eligible to be provided for the client. The way that you would resolve this exception is you would click on the exception, and in the General tab of the Visit Details screen, which is the first tab that shows up in the column of tabs when you open up that visit, you're going to see the payer, program, and service fields listed. You will also have the ability to click on the drop-down and change the service that is applied here, and put in your reason code and resolution code to resolve the exception, just like you would any other exception. But please keep in mind, if you have several visits that have this unauthorized service exception, because there is a certain service that has not yet been added to your client profile, the best way to resolve these exceptions is to go back into your client profile, add that payer, program, and service, and then it will recognize that service as now being eligible or authorized for that client. So that would also resolve the exception, and it would resolve multiple exceptions if they had occurred for the same service. So that would be the easiest way to address that. Now, I've mentioned that another change for phase 2 is that exceptions are now configurable by payer. And what this means is that whether or not an exception shows up on a visit is based on the requirements of for providers of that particular payer. At this time, the only payer who has different exception criteria or requirements for providers is DODD. They do not, or providers who provide DODD services will not be required to capture client verification. So the client signature exception, the service verification exception, and the visit verification exceptions that could typically occur for other services provided in EVV would not show up in visit maintenance for DODD services. Now, something to keep in mind is exceptions are configurable by payer, which means if you have the unauthorized service exception because there is a service selected, for instance, but no payer yet assigned to your visit. So if the payer of DODD is not listed on the visit, you could still see these exceptions. It's only when DODD is listed on the visit and recognized that those exceptions would go away. So if you are a DODD provider and you've already logged some phase 2 services, but you've seen these exceptions, please just ensure that the payer is listed appropriately on that visit, which it should be as long as you set up your payers in your client profile and staff are selecting a service that has been set up or authorized for your client. So all of this kind of feeds into and builds off of each other. So if you set up your client profile and your payers appropriately to begin with, you shouldn't have to worry about your unauthorized service exception or seeing exceptions that don't apply to you as a provider. Now, if you want to quickly be able to see what payer is assigned to a visit in visit maintenance, that is an option that has been added to your visit display grid. So when you first search for visits in visit maintenance, you'll get your visit results show up at the bottom of the screen. All right, so the bottom screenshot on your screen is showing what your visit results would look like. We have one visit showing, and then we have different columns of information showing up: client name, employee name, service. To the right-hand side of that visit display grid, you would see show display options. So the top screenshot on this screen is calling out what that show display options link looks like. And when you click show display options, you're going to see every available column of information there is to be selected and displayed for you when you search for visits. There are several pieces of information that are selected for you by default, and that includes the client name, the visit date, call in, call out, service. But there are some additional options that have been added in phase 2 or have more value for you to see in phase 2 that you could consider adding. One of these options is group visit code. So if you are a provider who does group visits, the group visit code is going to become important if you need to add additional clients into a visit or just see clients who have been put in the same group visit. So clicking show display options and checking the box to group visit code, and then closing that grid, that show display options box or grid with the X, is then going to put that group visit code column in your visit display grid. And you have the bottom screenshot on your screen that's indicating what that would look like after you've checked that group visit code box and closed the show display options box. Before we move on to the next slide, I want to go ahead and point out that you'll notice one of the options in that show display options box is payer. So if you were to check that payer box and then close your options, you would see payer added as a column. And that's how you could quickly view what payer has been associated to which visit. I also want to point out before we leave this screen, for any EVV providers who were using EVV in phase 1, or for new phase 2 providers, you could check the units box as well before closing the show display options, and it would show units in your visit display grid for the visits that are showing for you. So that's a quick way that you can quickly see and compare to your claims what visits are in EVV, or what units rather are assigned to visits in EVV or have been calculated, versus what units you have placed on the claim. Now, I want to go ahead and remind everyone at this time that there are no claims at all, either for phase 1 or phase 2, that are being denied due to EVV. So EVV data is not determining whether or not providers get paid. Down the line, though, such as August 5th, when phase 2 is mandatory to be used by providers who are providing EVV eligible phase 2 services, you will start seeing edits on claims where a match between the visit on the claim and EVV could not be found. So units is a key item that you would check if you did receive an edit saying, hey, something's not matching between your claim and EVV. So that's another reason why you'd want to go ahead and check that box now. Speaking of unit calculations, Another key item to know and to point out is that unit calculations require a payer now. So in phase 1, unit calculations were all for ODM visits. And ODM was the only possible payer to be assigned to visits because only ODM's fee-for-service services were eligible for EVV. So units could be calculated if there was a call-in and a call-out only. However, with phase 2 and additional payers coming into play, a payer must be associated with a visit in order for the proper set of unit calculations to be applied to that visit. Now, at this time, the only payer who has a different set of unit calculations is DODD. So I'm going to point out an example here based on the visits that the sample visits we see on this graph of the slide. So the top visit that we see in our search results here has a payer of DODD. And the visit was 2 minutes long, which for DODD equals 0 units. The second visit down is for a pair of ODM. This visit is 3 minutes long, so both visits are between 0 and 15 minutes. But the units calculations for ODM as a payer would make this 1 unit. So that's why it's so important for a payer to be assigned to visits before you would see anything listed under the units column. And that's how you can also ensure that the proper units calculations are being used. All right, the final thing that we'll review before we get to questions today are the changes that you'll see when you go to log visits in EVV due to phase 2. So this would include added languages in the EVV system, logging group visits in the QandA mobile application, and also in telephony or TVV. So just as a reminder, the languages that were available in phase 1 include Arabic, Egyptian, Chinese Mandarin, English, Russian, Somali, and Spanish. In phase 2, the total number of languages available in EVV has expanded to 13, and the added languages include Hindi, French, European, Fula, Nepali, Serbian, Swahili, and Vietnamese. So these 13 languages are available to both staff and clients to use when logging visits. And that would be in both the mobile visit verification application and telephonic visit verification, or TVV. So we're going to first take a look at changes that you could see in mobile visit verification due to phase 2, and we're going to focus on group visits. Since we just mentioned the expansion of languages, just know that the first time an employee goes to log into MVV, they'll be able to choose what language they want to view the mobile application in. The first time you go to set up your client in the EVV portal, you can also select their preferred language. All right, so since we've reviewed that, we're going to focus on group visit changes in MVV and TVV. Now, when a staff member or a direct care worker logs into the mobile visit verification application, which I want to go ahead and mention, you can download on your own smart devices. So we reviewed how to request an EVV device earlier in this presentation, but that is only if you want to use the ODM provided EVV device for mobile visit verification. If you would rather download the QandA Mobile Connect application onto your own smart device, and that's either Android or Apple, that is perfectly okay. You would not need to request a device if you went that route. So when the staff member or the direct care worker logs in to mobile visit verification and they search for their client, they're going to see added options at the bottom of the screen that say start group visit, join group visit, or there's even a continue visit option. Let's say you're going to start a group visit. Okay. When you go to start the visit, you'll be selecting a service. It'll also have the date and the time of the visit and the client's name listed. And then you would select start group visit. Now, just as a reminder, a group visit is an employee or one provider providing services to more than one client, and I should say providing the same service to more than one client at one time. Okay, so you are one direct care worker and you are working with more than one individual to provide services at the same time. That is a group visit. So you would put in your service that you're providing, start your group visit. You would get your confirmation box that would let you know the service that's been selected and the time that it's starting, and it would ask you to confirm if this is what you would like to select at this time. You would tap yes. Now, once you do, your group visit code will be generated and displayed for you at the top of the screen. So any client that you go to add to this group visit would be under the same group visit code to indicate that that group of clients was receiving services at the same time from you as a direct care worker. So you'll see the person that you just added underneath that group visit code, and you will also see the ability to add another client into that group visit at the bottom of the screen. So if you were to tap Add Client, you would get the search box again, and once you searched for your client and went through the same process of selecting a service, confirming that you did want to add them into the group visit, you would see your group visit code at the top of the application and the client that you have added in listed underneath the client that you had before. Now I need to correct what I said before, because the client in the top of our group visit was receiving service G0300, and the client who we just added is receiving service G0299. They can be different services provided and the same, or I'm sorry, different services, but a group of clients in the same group visit. Something to point out at this time is that an employee of an agency, a direct care worker for an agency, or a non-agency provider will only see the clients he or she has added to the group visit, even if other employees or non-agency providers join the group and add clients. So you could have two direct care workers working with a group of individuals at once. They could be in the same group visit, but they would only see the clients that they themselves have added to the visit when they log into the mobile visit verification application or the QandA Mobile Connect application. There is no limit to the number of known clients an employee or non-agency provider can add to the group visit, or the number of employees or non-agency providers who can join the group visit. However, it's good to be aware that an employee or non-agency provider can only add one unknown client to the group visit. So if you don't have the Medicaid ID or the client ID from QandA to find an individual, you can still add an unknown client into a group visit, but the limit for that is one unknown client. Another good item to note is that a group visit code is only valid for a maximum of 24 hours. So within that 24-hour period, once the last visit in the group ends, the code is going to be closed. But as long as there is at least one individual still in that group, the code will be available until the 24-hour mark when it was created. And that's because no visit is able to last longer than 24 hours. And that is according to ODM and service rules. All right, so let's talk about joining a group visit. Let's say you are a direct care provider and you have come to provide services, and there is another direct care worker who has already set up a group visit. You would just like to join that visit. When you log into the mobile application and you have found your client, one of the options at the bottom of your screen includes join a group visit. When you tap join a group visit, you're going to be asked for the group visit code. So remember a couple screens ago, when we added a client to a group visit, there was a group visit code that showed up at the top of the screen. If I'm a direct care worker who just arrived and I want to join that visit, I would ask the direct care worker who's already there, hey, what group visit code are you currently working under? And they would share that with me. And then I would put that group visit code into the box, and select Join Group Visit. If I've entered the code incorrectly, or maybe I've misunderstood it and just put in the wrong code, I'll get a pop-up that says Group Visit does not exist, or I'm sorry, rather a red text that says Group Visit does not exist. And if I've entered it correctly, then I will be able to join that group visit. Now, since I've already had to select a client before I even see the Join Group Visit screen, I've already selected a service, and I have the time that I started doing all of this. So I'm being asked to confirm the service I'm going to provide for the client that I've already found, confirm the clock-in time, and say, yes, I want to go ahead and join that group visit. So just as a reminder, because these points are key, each direct care worker in a group visit can only view their own clients that they have added to the visit, and only one unknown client can be added per group visit. So let's say you've already added a client to a group visit, you have one in progress, and you log back into the device. If you wanted to add a client to your existing group visit after you've logged out of the device already, this is the screen that you would see. At the top of the screen, you would see that you have a group visit in progress. It started and then the date. You'd see your group visit code, and you would have options to abandon your group visit, resume your group visit, or search for another client entirely. However, if you know that your client is not yet in EVV, or you've already tried searching for them and you can't find them, then you can use the Start Unknown Visit option at the bottom of your screen. When you do that, you'll get a screen that allows you to put in the first name, last name, and Medicaid ID for that individual. Now, this is not putting the client into EVV for you. This is just indicating for whoever's going to manage this unknown client exception later in visit maintenance, who it is that you were intending to provide services to, so that they can make sure that that client gets added to EVV. All right, so after you put in that information, you would continue visit. Notice that Medicaid ID is not a required field. It's helpful for whoever is going to be cleaning this visit up later, but if you don't know it, it is not required. So you'd still be able to move forward. And if you continue visit, you would select the service, and you could start group visit for that client. It'll ask you if you're sure you want to start a group visit, and you say yes, and you would be good to go. Now let's go over what happens when you complete a group visit, or you would end just one individual's visit. So if you had multiple individuals in that group visit, but you only wanted to end the visit for one individual in that group, that's the workflow that we're going to cover now. So when you first log into QandA Mobile Connect, if you've already had a group visit started, this is the screen that you would see. And you would have the option at the top of the screen to resume your group visit. So you would tap resume. You would see the clients that you have added to the group visit. And there are two icons showing up for each client. There's a play icon, and then there's a dash icon. If you wanted to end the visit for any of these clients individually, you would click that play icon to the right of the client. Now, I just want to note, you do have the option to end this visit as a whole, the group visit as a whole, and I'm going to show you how to do that in just a little bit. But this is just if you want to end that for one particular person. I'm going to back up. Because once you click that play icon, it's going to ask you for verification information, as long as this is not a DoDD service. And we see the code is G0300, so you'd be asked for verification. And you could continue and end that service for that individual. And then the next individual, who in this example is A01, that's their name, they would remain in that group visit until I ended the visit for them. If you wanted to end the group visit for all of the clients at once, this is the process that you would use. So again, we're back at the point where we just logged in to the mobile application. You can see the group visit is in progress, and you would still tap that resume group visit icon, only now you would use the complete group visit icon that shows up at the bottom of the screen. So this is completing the visit for the entire group, which you will get a pop-up asking if you want to do that. Are you sure you want to complete your group visit? And if you do, you would say yes. And then you would essentially be led through your verification and you would be good to go. If you need to abandon your group visit, when you log in, you would see your group visit is in progress. And this is if you've just set up a group visit, let's say for one client, and you selected the wrong code and you just want to start over, or you realize that you made a mistake, or whatever scenario it is that you would like to abandon the group visit, you would use your abandon group visit option to do that. Now, when you select abandon group visit, you have the option to only abandon by individual. So just like you could end the visit through verification by individual using the play icon, you can also abandon for just one individual. So let's say you accidentally added them into the group visit when you wanted to log an individual visit for that client. You could use the dash icon, and it would allow you to abandon the visit for just that one person. However, if you wanted to abandon the entire group visit for all clients listed under your group visit code, that's when you would use your abandon group visit. Sorry, I skipped ahead a little bit. I forgot that I have a touch screen. You would use your abandon group visit icon that shows up at the bottom of the mobile screen. And this will ask you, are you sure you want to abandon the group visit in general? And you would say yes. And then your visit would be ended completely, and you could either start logging a clean visit for an individual or start a whole new group visit if you needed to. Now that's the group visit functionality that has been added to mobile visit verification, or MVV. Because group visits are available, and they need to be available any method that you might use to log visits, there have also been changes to telephonic visit verification, or TVV, and there have been additional prompts that have been added into the TVV. Now, group visits is one reason why the prompts have changed on TVV lines. The other reasons include a functionality that was requested by ODM to be added as a courtesy to providers. So ODM had been getting several calls from providers with some confusion because they would type their employee ID into telephony, but then when they get to visit maintenance, realize that telephony did not recognize the number they thought they typed, or they had typed the number incorrectly but didn't realize it at the time. So to save you from having to clean up your employee ID later in visit maintenance if you accidentally enter it wrong, there's also been a prompt added asking you to confirm. It'll repeat your ID back to you and ask you to confirm if it's correct or not and give you a chance to re-record. And that's the red box that you see on your screen. It's calling out the main changes in the telephony line when you are calling in. So at the top of this box, this is after step 2, it's saying you entered, and then it repeats your Samtrax ID back to you. This is your employee ID. Please press 1 if yes, 2 if no. And if it was an invalid Samtrax ID, it's not recognized as an employee ID under the account whose number you called in for, and it'll tell you that as well. If you say yes, that's the correct ID, it's then going to ask you, is this a group visit? Press 1 for yes, 2 for no. If you press yes, then it's going to lead you into the group visit prompt. Now, if you are trying to log an individual visit, you would just say, no, it's not a group visit. And the prompts will continue on as you might have already known them in phase 1 if you were an existing EVV provider. But if you say yes, it's a group visit, it'll ask you to enter your group visit code if you want to join a visit, or to start a new group visit, you could press the appropriate code. So it's press 1 to add a client to group visit, press 2 to complete a visit, press 3 to hear the group visit code, press 4 to abandon. So you have several options there. And then once you select the appropriate option, if you need to add a client, it'll say press 1 to add client, and it will lead you through the remainder of the process. The call out prompts for telephony have changed just a little bit as well. Again, you have the ability to have your Santrax ID repeated back to you and confirm that it's correct before moving forward. You're again asked if it's a group visit because the call-out process will be a little bit different if it's a group visit. And then you would continue on based on your selections. Okay, so if you are calling out for a group visit code, you would need to enter that group visit code in so it knows which group visit needs to be ended. You would get your group visit prompts, press 1 to add a client, 2 to complete, 3 to hear your code. And then if you need to complete the visit, you would press 2. And you'll be asked if it's a call in or call out, you'll say call out, and then it will lead you through ending the visit. Now, those are the key changes to the calling in and calling out processes, and we've outlined those for the English line. I do also want to point out that, well, and before we do that, if you're ending a visit for more than one client, it will ask you to end the visit for the first client, hand the phone over to the client, or press 2 if the client's unavailable. If you are a DoDD provider, you are not required to capture client verification for your client. However, telephony is not going to recognize what your payer is. So when you get to the point that it says, please hand the phone over to your client, or select 2 if your client's unavailable, you can either hit 2, client unavailable, or just hang up. However, if you have more than one client that you want to end a visit for, you'd want to select 2, client unavailable, so that you can move forward and end the visit for any additional clients at that time. And the red box that's calling out here is just saying, hey, once you get to that second client ID, if you have another client that you need to end the visit for, you would enter their ID and then repeat steps 8 through 10 that's in the call-out guide. All right, and then I mentioned before that since there are now 13 languages, the multi-language line has the changes in prompts that we just reviewed, but it also has 13 languages that are available to be selected instead of just the original 6 from phase 1. So I wanted to call that out as a difference in the telephony prompts as well. Now, this is also a good time to note that along with the telephony prompts changing, the telephony service codes list has also changed, primarily by being expanded because there are new services that are now EVV eligible under phase 2. So if you are an existing EVV provider before May 6th, you're going to want really, the new call reference guide that walks you through the changes and prompts that we just reviewed for telephony. You're also going to need and want this updated phase 2 telephony service codes list. And you can find both of those items on ODM's webpage. So I just want to go ahead and point that out. In fact, here, our next slide provides a screenshot calling out where you can find those items. So if you were to go to ODM's webpage and you were the EVV initiatives page, and you were to select the providers tab and scroll down, there is a phase 2 section where the EVV phase 2 call reference guide is listed. So you can print that off and distribute it to your staff. If you're an agency, if you're a non-agency provider, you can just print that off and take it with you. And under resources is the phase 2 list of services for EVV. And I know it says phase 2 list of services, so it may seem like it's the list of services we showed at the beginning, but it's really your telephony service codes. So this is where you would want to go to print off that list of telephony service codes I just showed, so you know the appropriate code to use when you are logging a visit through telephony. All right, at this time, we're going to go ahead and take a look at the chat box for any questions that have come in so far. If you have not had the opportunity to put your questions into the chat box, we'll go ahead and give you a few moments to do that now, and then we'll start reading through those questions and answering them live over the line. The first question is from somebody who has already been using EVV for a little bit, and their question is, the service of, I think it's G0299, is listed twice when the nurses go to select it. Why are there two of the same? That is something that we are currently working to correct. There was a slight change in a phase 1 service. It was State Plan Home Health, so SPHH, and the program name changed to just SP in phase 2, which means we had to add an end date for the SPHH on 5/6 and just have it listed as SP moving forward after 5/6. We actually had this reported from providers and realized that there are a couple places in EVV where 2 codes are showing instead of just the 1 after that end date. So we are in the process of correcting that at this time. You can go ahead and select either of those. All right, there is a question that came in here, and apologies because it took a little bit longer for me to read through. It is a very in-depth scenario, so I'm not going to read the entire one, but I'm going to summarize instead. So the question here boils down to that you feel there should be additional service codes that are available to select under MyCare as a program in EVV. And I want to go ahead and note that we did have this question come in last week into the ODM EVV mailbox. So apparently there are some other providers who might have this confusion as well. But we did double check at that time that the appropriate service codes that should be listed for MyCare are listed in EVV at this time. So if you don't see a particular service code that you think should be for a program, that's because that service code should not be entered for that program into EVV. But just to make sure that you can discuss this further if you would like to with policy, we are going to send your specific scenario in question onto policy at ODM, and they'll be following up with you. The person who asked the question about Aetna Better Health and those MyCare service codes, if you wouldn't mind just entering your contact information into the chat, that would help us pass that along to policy as well. Thank you. Okay, forgive me, there was another question at the end of that. We have patients under Medicaid. It means SP, state plan. Would you please explain what kind of patients are under Ohio Home Care Waiver? We're not quite sure what that question is asking, so not sure how to answer that, but that again seems like something that would be a good conversation to have with ODM policy, as they can get more in depth into exact types of services, who's applicable, things like that. So we'll pass that second question along to them as well. Okay, there's another question that's come in here. If there is a two-person home and one person leaves for a visit with their family for a day, does that site become an EVV site for the day? Again, not quite sure the scenario that you're thinking through here, but if it has to do with daily billing units, just know that if you would be billing that visit using the daily billing unit, it would not have to be logged in EVV. If you would be billing that visit not using the daily billing unit, or in other words, 15-minute increments, it would be eligible and must be logged in EVV, as long as it's an applicable service code. The next question we received, will we be able to print this presentation as a reference? It would be a valuable tool for those of us who receive questions from DSPs. Absolutely. Also, if it's the explanation that you're looking for that went along with this webinar, I highly recommend looking for the recording to go along with the presentation slides. The slides aren't going to include all of the speaker notes that I've been giving here, but they will provide the information that's been on the slides. So depending on what your purpose is, you may want to use the recording along with the slides. And both of those will be posted to the ODM website under the new webinar section. Okay, this scenario is from a DODD provider with an apartment building that has 46 units. Each resident is billed separately. It is not a daily billing unit site, so this provider's already identified that they would need to use EVV. The question is, we would need 46 devices, technically, because of the 46 units at this location. However, there might be just a set of staff working with the individuals at this location. So, is there anything different to be aware of with this scenario? And also, can the devices be sent to the administrative offices versus each separate apartment? And then they also say they have 3 different locations, so they have multiple apartments at one location. This is a unique scenario. I do want to go ahead and point out that if the bring your own device model for logging visits through mobile visit verification would be more appropriate or would be easier for your organization, please remember that you are more than welcome to go ahead and use it. So you could request a device for each of the individuals in the apartment. You would want to do that rather than just pick and choose individuals, because I think that would probably get confusing as to who has what. Or you could have staff use their own smart devices or smart devices issued by your organization where the QandA mobile application has been downloaded on it. Either of those options can be used, but if you're going to request devices, you would want to go ahead and request for each individual. As per sending the devices to the administrative office, I'm going to defer to my ODM EVV counterpart here.
ODM prefers that all the devices be shipped to the individual's home. That way, any providers providing services to that individual has that device available to them.
Yeah, I would realize that it could be a little bit different for DODD providers. So the bring your own device model may be the best way to go if it fits your business practices and your organization. So that's the answer to that one. So the next question here is, under exceptions, you have that it will not apply to the services billed for DODD using the daily billing unit. What about the monthly billing unit? We have some quizzical looks in the room. So we are looking that up right now. Unfortunately, we haven't heard of the monthly billing unit, so we're reaching out to our DoDD counterparts, and we'll get back to you with the answer to that question. We do know the direction that we've been given is that EVV is only eligible for if you bill in 15-minute increments, so hopefully that helps. It's sounding like that monthly billing unit is not that 15-minute increment setup, but we are double checking that for you. The next question here, when creating employees, why is the SSN required? What is this used for? SSN is a unique identifier for every person in our country. So of course it would be a unique identifier for every employee or person in this state. The Ohio Department of Medicaid uses Social Security number to identify non-agency providers, to identify direct care workers who might fall under agencies. So it's a unique identifier that can be used for employees or non-agency providers across the board. There really is no other unique identifier that reliably would be assigned to each individual in Ohio who is providing services that could be used. The next question, there is no SDD code on the last slide, so I think we're talking about telephony service codes as that last slide. Also, my client has a self-waiver. Self-waivers, or that SDD code, self-directed code, is not included in phase 2, so that's why you wouldn't see the code listed. So if those are the services that you're providing or your individual is using, you do not need to use EVV at this time. Self-directed services will become subject to EVV in a later phase. We did just receive the answer back about that monthly billing unit, and it is classified as a daily billing unit, so it is not subject to EVV. So I wanted to go ahead and provide that back. We have another question come in. If we choose to use an alternate provider to track some of our clients, can we also use the EVV device that the state issues for some of the clients? And the answer to that is no. The device that is issued by the state has the QandA mobile application loaded on it, which means you must be using QandA in order to use it to log visits. So if you are using an alternate provider to log visits, you must use whatever methods that alternate vendor has provided for you to log visits. The next question is, how is patient liability billed? For patient liability, you will continue to bill just as you always have. EVV does not affect how you bill your claims. If you need assistance with how to bill patient liability and how to subtract that from your claims, you're going to want to call the Provider Assistance Hotline at 1-800-686-1516. And then the last question that we currently have in the chat, is there someone I can talk to provide technical assistance for this scenario? And I believe that goes along with the alt EVV scenario. It might be a different one here. Oh, that's the DoDD device scenario. In that case, you could reach out to the ODM EVV mailbox and they can help route you to the right the right folks to talk to. So you would do that by emailing odm@medicaid.ohio. I'm sorry, scratch that. I don't know what I was thinking. You would email evv@medicaid.ohio.gov. My apologies. So just to clarify, if you need assistance with that DoDD device scenario that we talked about earlier with the 46 apartments, please reach out to the ODM EVV team at evv@medicaid.ohio.gov. All right, the next question, for DoDD services, if a visit lasts longer than 24 hours, will the visit be auto-ended by SANdata? Will the staff need to start a new visit after 24 hours? And the answer to that is yes. For the DoDD service codes that are currently EVV eligible in phase 2, 24 hours is the visit limit. So you would have to start a new visit after 24 hours. It could be that you are thinking of a service that is provided that is not currently subject to EVV because there are some exclusions. So we are checking with our DoDD counterparts to see if they know off the top of their head a service provided that could last 24 hours that would not be subject to EVV. But I would also recommend pointing you to the link that we showed earlier in the presentation. Again, these slides will be up on ODM's website. But if you go to ODM's EVV Initiatives webpage and you go to the Providers tab, under the Resources section, there is a General Excluded Services link that you can click on. Because if your visits are lasting longer than 24 hours, it may very well be a service that's not subject to EVV. And the other thing to keep in mind with that scenario, if you are an agency that just has staffing that goes longer than 24 hours, that could be different than an individual visit and their visit length. And that would make a difference as well. For the individual, you would still need to start a new visit after 24 hours, but that could be why it's in your mind you're thinking the visit would last longer than that. We also did just confirm with our DoDD counterparts that DoDD providers cannot bill for longer than 24 hours. So hopefully this will clear that up for you. Okay, we are approaching 1 p.m. And we will need to shut the webinar down at that time. So if there are any remaining questions, please feel free to type them into the chat box at this time. And we'll go ahead and answer those with the time that we have left. There is one remaining question that came in here. It's if you take 2 individuals on vacation and they are 24-hour staffing, then how is that billed? As a group visit, or I think as a group visit is the question. And then clarifying there are 2 staff members that go on vacation here. We have sent that question on for clarification and a clear answer. We don't have one at this moment, but want to let you know that we have passed that along. Okay, we are still following up on that last question about 2 individuals on vacation and the 24-hour staffing. We're going to follow up with you, the provider who asked that, after the webinar, and we'll provide the answer back to you. I'm sorry we don't have it at this exact moment, but we will be reaching out to make sure that you get that answer. I want to thank everybody for taking the time to join today's webinar. Please keep in mind that there will be ongoing webinars, educational and informational opportunities. Just be sure to check back on ODM's website, their new webinar section, which will list those. That is also where this recording and presentations that will be placed. Thank you, everyone, and have it. Oh, and one more thing I want to add. So if you've been listening in, just know that this is not a replacement training for phase 2. It is not a replacement training for existing EVV providers, bringing them up to speed on phase 2. These have highlighted the biggest changes in phase 2, but there's additional information that is gathered by going through training, and training is still the requirement. So please just be aware of that. If you have not taken phase 2 training in the Learning Management System or LMS portal, you would want to log in and still sign up for that. All right, thank you everyone, and have a great rest of your day.